is Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development, and welcome to today's webinar. Today's webinar is entitled Supporting the Mental Health of Farm Families in the North Central Region. Our presenters are Carrie Henning-Smith and Florence Becot. Let me give you a quick summary of the webinar and give a little background about the presenters, and then I'll pass it on to them to get us going. Farmers and farm families in the North Central region face lots of different types of threats. We're aware of those factors, including changing demographics, limited access to health care, strained finances, weather variability in market prices, as well as geographic and social isolation, not to mention the challenge with the coronavirus that we're all facing and that farmers are facing as well. So all of these issues impact the agricultural industry and can lead to innumerable types of stress, depression, burnout, and suicide, which is higher among farmers and farm families compared to the general population. And so this webinar, those who worked on the project are looking at the different types of models that are used to support mental health farmers and farm families in the North Central region. And so we look forward to hearing a little bit more about that. Carrie Henning-Smith is an assistant professor of health policy and management at the University of Minnesota School of Public Health and is the deputy director of the University of Minnesota Rural Health Research Center. Florence Becot has a PhD and is a sociologist and associate research scientist at the National Farm Medicine Center. And so with that, I'll remind the participants that if you have a question or a comment, you can type it in the chat box and the presenters will either address it along the way or at the end. And so with that, I'll pass it on. Carrie and Florence, thanks again for being here and sharing your work.
Thank you, Mark, and thanks to everyone who's signed on already. We are excited to have a good crowd with us today for this important and timelier than ever topic, unfortunately. So my name, as Mark said, is Carrie Henning-Smith, and I'm presenting alongside Florence Becot on the issue of supporting mental health of farm families in the North Central region. We first want to thank and acknowledge the NCR-CRD for support for this project. And we also want to thank and acknowledge our other collaborators and colleagues on this project, including Shoshana Inwood from The Ohio State University, Andrea Bjornstad from South Dakota State University, and Andrew Alberth, who's with me at the University of Minnesota. This project was truly a team effort. It was a wonderful team. I also want to note that this project in some ways is still very much a work in progress. You're going to hear about some work that's completed and published and some work that we are still analyzing results on and working to publish. And so your input, your thoughts are very much welcomed for this project and for ongoing work in this space. Here's where we're going to go in this brief webinar today. First, we're going to give you some background on mental health issues in the farm sector. We're going to talk about challenges and needs of the farm population. Then we're going to talk about results from an environmental scan we did looking at programs targeting the farm population and their mental health. And we're going to talk about where this project has gone since last year and where we're headed moving forward. With that, I'm going to hand it over to Florence for a bit.
Thanks, Carrie. So what I will do to start us is a very quick overview of what mental health issues are in the farm sector, and in particular, some of the factors at play. And I won't spend too much time on it, but the idea was that there might be some folks on the call who are not familiar, as familiar with the issues of mental health in the farm sector. So as Mark mentioned earlier when he introduced the talk, we know that globally, agriculture is one of the occupations that experiences some of the highest stress levels. And it is also one of the occupations that experiences some of the highest suicide rates, which really brings up a very simple question is, what is different about agriculture? So there are a couple of things. First, we know that farm families in particular there are deep interconnections between individuals, the family, and the business. And the overlap between those three spheres lead to competition for time and resources and constant interactions. So here we're talking about things such as time. How do we spend our time on the farm? Do we spend it working on the farm? Do we spend it on an off-farm job to get additional income or to get health insurance coverage? And it is similar level of questions around financial resources. The other piece too is that farmers are embedded in complex agro-family systems. And what this means is that not only they are the space spheres that are mentioned, but they're embedded in these larger systems. What this means is there is a certain number of factors that farmers do have control over, in particular when things are not going well, they might be able to make changes. But we also know that a lot of what shapes farmers and the farm operation is really out of their control. So we're talking about things like the weather, pest pressure, but we're also talking about things like the farm economy, international trades, and so forth. And we know that together, all of these factors directly and indirectly impact the mental health of farmers. So while the issue of mental health challenges in the farm sector is not new, I would say that over time there has been increased pressures on farmers, and some of those factors are connected to growth in urban populations and increased rural and urban divide. And in some places, we haven't seen it so much in the US, but in some places, including in France, there are conversations about agribashing and what does that mean for the health and well-being of farmers. There are also issues connected to changes in the climate and what is that going to mean in terms of agricultural productions and stress. There has been further concentration in consolidation in the food system, which brings up questions about how much choices do farmers have with their production. And last, there are issues connected to the demographics of the farm sector with an aging farm population, which not only brings up questions about the health and well-being of these older farmers, but also brings up questions about farm transition and the recruitment of the next generation of farmers. So at the time that we started working on this project with the team, we were really starting to talk more about farm crisis in the Midwest. And we were, those are some numbers that we gathered in news media. Farm Aid was seeing their coal increase by 109% in 2018. And Legal Aid of Nebraska was saying that coals were similar to those of the 1980s farm crisis. And then even more recently, with COVID-19, we're seeing further challenges for the agricultural sectors across the country and across commodities. And all of these things are impacting farmers and their mental health. So really the goal of this project was to look at how do we support the mental health of farm families in the 12-state North Central region. And our questions were pretty simple. What are the challenges faced by Midwest farmers? How should we address their challenges? What types of supports are available? And what gaps remain and how can we meet them? And so we had two parts to the research, came farming interviews and the environmental scan. And I will let Carrie describe how we went about the research.
Thank you, Florence. So as Florence said, we have two different components to this project that we're going to be talking about today. I'm going to quickly walk through the methods of them, and then we'll walk you through some of the results from both of these. First, we did a series of key informant interviews from July through December of last year. In these interviews, we were able to talk with 19 different subject matter experts. 9 of those represented different North Central states. Many states were represented multiple times in our study, and then we had some national expertise among the interviewees too. We talked with people across a range of sectors, including people who were mental health providers themselves and saw farmers and farm families in their practice, people working in research focused on this area, people working in state agencies and extension programs, people in agribusiness, and farmers themselves. For the content analysis, we had 2 coders, and we identified 4 domains: challenges, subpopulations, coping strategies, and interventions and recommendations. I will briefly touch on each of those in just a couple of slides. But next, our methods for the environmental scan. This is when we were looking to see what already existed, what programs were out there that were targeting the mental health of farmers and farm families in the North Central region. We did this between February and May of last year. We used several different search terms. I'm not going to read them all, but you can see them here in the yellow box. We were making sure that we were covering our bases, knowing that mental health is sometimes referred to with stress or coping or some other euphemistic expressions. We looked to see what programs, who programs were targeting. Were they targeted directly to farmers and farm families, to agriculture, to the more general population? And then what format was the material or the program delivered in? And who was it delivered for? What type of support was offered? So as an example, for the type of support offered, we identified programs as being self-help programs. Here, we'll give you some information, you help yourself. We will directly help you, or something else. For the delivery format, we looked to see whether it was simply information provided through a fact sheet or web page, a hotline, in-person counseling, workshops, presentations, other types of information. We used a deductive descriptive coding approach to identify the types of programs and to code them together so that we could categorize them. In doing this, we divided states among the research team, and we rotated and replicated searches so that all 12 states in the North Central region were thoroughly scoured for any programs they might have operating. I'm going to walk you through the results for the key informant interviews. You can see on the red arrow on the top, we heard a lot about micro level or individual level factors all the way over to macro level factors. In theory, these micro level factors are under an individual's control and they might be able to do something about them. But as you'll see, even micro level factors are influenced by macro level factors and can be hard for an individual farmer or farm family to control. We heard a lot about family concerns, things like a legacy, differences in opinion among generations that led to mental health concerns and stress. We heard a lot about finances, debt, stress, prices, and tariffs. The further to the right on the slide, the more macro level the concern was. We heard a lot about access to health care. If someone has a mental health concern, are they able to get the care that they need? And with that, we heard about insurance issues or access to insurance, and we also heard about provider shortages, particularly mental health providers in rural areas, and how far farmers would need to travel to access care. We heard a lot about farm planning, including managing employees for larger farms and changes over time and uncertainty in what the future might hold for the farm. And finally, we heard quite a bit about weather, including unpredictability and variability, climate change, severe weather events. Altogether, these challenges amount to considerable stresses on a farmer, and you can understand why farmers might feel a great deal of pressure and need help for coping. We also heard a lot about different subpopulations within the North Central region and who was farming and how their mental health was impacted differently depending on who they were and what their background is. A few different themes under this. We heard a lot about individual and household variation. So age of the farmer, gender of the farmer with particular concerns for female farmers, race and ethnicity of the farmer, and the family structure. Was this a couple where both people were farming? Are there young children on the farm? Each of those makes the challenges that we just talked about play out differently. We also heard about differences in the farm operation by scale, by type of commodity, and by region or place where they were located within the North Central region. And these differences in populations mean that there are different challenges and needs, mean that people have different coping strategies, and it requires different solutions. When we asked the key informants about the types of coping strategies that they saw farmers use or that they had used themselves, we heard about coping strategies that fell into one of two themes. One was very positive, proactive coping, people who were seeking care, looking out for peer support, being support to one another, and asking for help when they need it. We also heard quite a bit about negative coping strategies, things like substance use, self-isolation, ignoring signs of distress, saying it's nothing, it's going to go away, distracting themselves with working or television or something else to kind of numb the pain so that they didn't need to face it head on, and then leaving farming, leaving agriculture altogether. And it's important to note that when we asked about coping strategies, we heard much more frequently about these negative coping strategies, really signaling the need for intervention here. So when we looked at ways that key informants recommended that we address challenges faced by farmers, they gave us three main themes here, three places where they felt like intervention was particularly needed and relevant. One was simply education. We need to reduce the stigma. We need to talk with people about mental health, increase awareness, talk about this as though it's something that we all experience and we all need to understand, because it is, and also increase knowledge of existing services. Then we heard a lot about increasing access to care, increase the number of providers, especially providers who understand rural populations and farming, increasing crisis lines and mobile crisis units for those moments of crisis when someone needs immediate help, providing integrated care to help reduce some of the stigma so that someone can get mental health care the same place they're getting primary care, and making health insurance available and affordable and high quality. Finally, we heard quite a bit about the need to address underlying root causes, not to just put a Band-Aid on the issue, but to address the real causes for mental health challenges. This included helping farmers with financial and succession planning, looking at diversifying farmers and farms and different needs for different subpopulations, countering loneliness, and addressing the structural issues underlying financial stress. We don't always think of this last bucket as mental health interventions, and I would challenge us on this webinar today to think of all of these as being mental health interventions. Now I'm going to pass it back to Florence to talk about our results from the environmental scan. But before I do, we do have a question for the audience, and you'll see it, I think, right where your chat box was. We would love to hear from you. In what other ways do you think challenges faced by farmers should be addressed? We'll leave this question up for a little bit. As I said, this really is a work in progress, and we're very interested in your thoughts and ideas in this space.
Thanks, Carrie. I give folks a few more seconds to answer, and then I'll jump into the findings of the environmental scan. I jump back to the previous slide in case folks want to see what we had on there. Great, there's lots of very interesting answers coming in. All right, so you can keep entering your answers, and then I will move on to the environmental scan. So as Carrie mentioned, we did an online search of a diversity of programs and resources available to farmers. And the way I would present the results is using the typology that we developed. So looking in terms of types of support available, we found 121 distinct programs with 162 individual components across the 12 states. And these programs really came from a diversity of organizations, extension, of course, being a big one, agencies of agriculture, I'm going to forget them, faith communities, farmer organizations, of course. So what we found is that most frequently, Fact sheets, web pages, workshop and conferences were the most often types of resources available. And we also found a fair amount of overlap in the type of information provided. And I don't think, this is not surprising at all, considering that the different strategies to manage stress, for example, to recognize the signs of stress, are, overall, there is a general understanding of what these are. The resources that there were fewer of were connected to in-person counseling and hotline. And there were considerable variations in what constitute counseling. Many of these resources actually focused on the financial aspects, on financial stress, but as Carrie mentioned a couple of slides ago, we know that financial and mental health are directly connected. And this is where we saw some legacy from the 1980s farm crisis, with ag mediation services connected to land and financial challenges. In terms of the hotlines, it was suicide hotlines. Many of them were for the general population, but here again we saw some of the legacies from the 1980s farm crisis. I think that there is the hotline out of Nebraska and then out of Iowa. So in terms of the target audiences of programs available, 2/3 of those resources were directly targeted at farmers and at farm populations. About 20% were for the general rural population, and this is when we tended to see resources connected to mental health, hotlines, access to healthcare practitioners. For service providers, about 10%, there were about 10% of the resources, and those were connected to train the trainer type of activities to provide tools and resources for service providers who work directly with the agricultural population. So that would be programs like mental first aid training with for example, the agricultural module. And then the last piece of the typology was in terms of delivery methods of the programs available. More than half of these programs were in terms of self-help, which is the information is made available and farmers can use it on their own time. So again, these were things connected to stress management, recognizing difficulties, and taking actions. Mediated help was the help that was provided through professionals, and there were two types of help. There was the help connected to the ag mediation services that I mentioned earlier, and then there was also the help directly connected to talking, for example, to somebody at a hotline. So next, what we did is we wanted to compare what do the experts recommended we do to support farmers versus what is available. And I want to recognize that one of the challenges with the environmental scan is that things are constantly moving. And while we were bounded in time, we know that resources are constantly added. But what we saw when we look at the first expert recommendations around education, which was to reduce stigmas, increase awareness, increase knowledge of existing services, we found that the majority of programming was for self-help, focused on identification of stress symptoms and methods of stress management, as well as training for service providers to identify mental health issues and direct farmers for help. So those are likely efficient, lower cost means of reaching farm families, which may help reduce mental health stigma and increase awareness. And one of the things too is that farmers can, for example, attend a webinar or look at a fact sheet at home when they are alone. As we know, there is a lot of stigma around mental health. So in terms of access to care, as a quick reminder, experts recommended increasing the number of providers, in particular the ones with knowledge of rural and agricultural issues, crisis lines and mobile crisis unit, integrated care, and health insurance. So I would say that most of the resources that we find are directly about increasing access to care, directly and indirectly. But one of the things that we thought about in seeing the resources available is the type of help that is currently available might not offer sustained help or help for more serious mental health problems. And this is where comes the issue of the lack of mental health care providers in rural areas. What we did not find was resources connected to health insurance and connected to how can farmers use their health insurance coverage to access mental health. And we do know from a project that I've been working on with Shoshana, who was on this project with us, and other colleagues, We do know that about 30% of farmers knew they had access for mental health coverage, but more than half of those farmers in that other study did not even know if their coverage, their insurance provided mental health coverage. So the last piece is connected to addressing root causes, and those root causes were financial succession planning, diversifying farmers in the farm, countering loneliness, addressing structural issues, and the underlying financial stress. So what we found is that those root causes were often mentioned in the material to explain challenges, and the resources that addressed the most those root causes were the ones connected to mediation services and trainings to help navigate farm business difficulties. And we also know that there are quite a few resources to help farmers with farm planning and farm transition. So the last piece that we will talk about today is what are the opportunities to increase support to farmers? And in a similar way that we highlighted the challenges faced by farmers, we're looking at those opportunities from a micro level, along a continuum with micro level opportunities, which are most likely the easiest to implement, less controversial, and most likely less expensive, to more micro level solutions that are probably the hardest and most controversial to implement, because as you see, many of those are political as well. And there's a lot of variations in agreement on what should be done. So in terms of education, opportunities are connected to providing more information on health insurance and telehealth. It seems that as a good practice, resources that provide information to farmers about mental health should systematically talk about, how does that intersect with health insurance? Where can people find help? At the same time, we know that issues connected to health insurance and telehealth are hard because there's so much variations. There's also a need to include on those resources, on those mental health resources, information about resources for farmers to financial support, both for the farm operation and for the farm household. And I was actually looking at some of the work from the 1980s farm crisis, where there was an extension agent from OSU actually reflecting back on what had been done to help farmers and what could have been done. And one of the things that the extension agent said was there wasn't enough discussion on what we could have done earlier to support farmers with difficulties connected to accessing food, housing, and so forth. So ultimately, by providing more information about access to insurance, telehealth, and financial support, that should hopefully help continue with decreasing stigma connecting to seeking mental health and financial help. So the next area of opportunities is around access to care. And a lot of these things I want to say have been said many times by other people who've been doing this work. It is about around training healthcare and agricultural service providers to be more familiar with the type of challenges that farmers might be facing, but also the best way to help them. So the mental health first aid training is an excellent example. There's also examples out of to do continuing education with medical providers or with medical students around a greater understanding of rural and agricultural difficulties. I think another opportunity is around the coordination to improve mental health coverage. And what we mean by that is having a diversity of actors come together to talk about what are the issues and how can we increase access to care for farmers. And so that means very simply potentially having folks on the agricultural sector, health sector, farm business sector talk together and talk about ways that things that could be done. In terms of sustainability, and I think some of this stems from, again, referring back to the farm crisis of the 80s, when a lot of resources were made available, and over time these resources disappeared due to financial support going away, or maybe the sense that they weren't needed anymore. And in reality, we know that crises are cyclical, they come and they go, and we also know that mental health care challenges for farmers and for the population in general tend to be chronic rather than episodic. So I think this is an important piece: is if we design new programs and resources, how do we keep them going? The last piece around increasing access to care is around increasing access to mental health coverage. And some people will argue in general to increasing health insurance coverage that is affordable and available to all. There is also questions around assessing and retaining the recent changes in telehealth. As some of you may be familiar with COVID-19, a lot of the telehealth rules were changed very quickly. And this is seen as an opportunity in the sense that it is now easier for providers to charge insurance. Some of the rules around where do people have to be to receive care have been changed very quickly. But there are some questions about, are these rules going to go away once COVID-19 is over? If it's ever over, right? And so the last piece is about addressing root causes. And this is going back to the idea of how do we support farmers? So it is through potential resources targeting and meeting the household financial needs. A lot of the support for the agricultural sector tends to be for the farm business, tends to be based on commodity, tends to be based on scale, and it means that not every farmer can access to those. And the last piece, which I think is probably the one that we talk not too often, and that is probably the one that is the hardest to do, but there is a need for greater consideration and action on the intersection between the agricultural economy and policies and farmers' mental health. In other words, how does the current economic system and policies impact the mental health of farmers, and what could be done so that some of those challenges are relieved? And so we have another question here for you folks is, what other opportunities do you see to increase supports for farmers? And I'll give you a few seconds before we move on to the next slide. All right, well, maybe we're very, oh, I see a couple of answers coming. All right, so some of these answers, I don't know if you can see them, but I'll read a couple, and then we move to the next one. Education about mental health in the classroom for students, going into agriculture, transportation, peer groups within own communities, financial-based training with some infusion of mental health awareness. Yeah, these are all these are great. All right. So next, obviously within the last month, and even since we've been working on this program, there has been a lot of changes since last year. And so as the crisis in the Midwest in particular worsened, there were a lot more additional resources from farm agencies, from extension, and it's true that it's been difficult to keep track of. One of the programs that came out of the 2008 Farm Bill was the Farm and Ranch Stress Assistance Network, which provides many opportunities to get a better sense of what type of support is out there and to maybe have more universal coverage of support. And then with COVID-19, I would say that things have been taken to a whole new level with many resources aimed at supporting the financial stress parts and resources. And what is maybe different from the programs that became available last year, the financial support as a result of the changes in trade and tariff, is that those resources are, and I'm talking in particular, for example, about the Paycheck Protection Program or the Pandemic and Employment Assistance. Those are programs that are more broadly available to more farmers, not on the condition of commodities or stuff. And I'll pass it on to Carrie.
Thank you, Florence. I just have a few more slides to end our time together today. And in these final slides, what we want to do is share resources for you that will be helpful for you going forward. First, most relevant for the presentation today, you can find an article or a publication in the Journal of Extension summarizing the results of the environmental scan. Stay tuned for an article summarizing the results of the key informants, hopefully in the next several months. And then we have a link to a presentation on farmer health insurance coverage in the midst of COVID-19. As Florence said, things are changing by the day, and there's a lot of good emerging information and support there. We're also leaving you with some additional resources connected to farmer and rural populations in general access to health insurance and health care that we hope you'll find useful. I'm sure each of you has ideas of other resources too that we would love to hear about. Additionally, for farmers themselves seeking help, we want to make sure that you are aware of different places you can find it. For mental health support, obviously healthcare providers, but university extension and state agencies of agriculture are vital partners in this work, as are farmer organizations. For financial support, USDA and state agencies of agriculture offer help, as do state departments of labor, small business administration, and farm commons. And if you're experiencing changes in health insurance coverage due to COVID-19, we offer some suggestions and ideas for you here to access health insurance. I'm going to end there, but I want to thank you for joining us today, and we are happy to stick around for a few minutes to answer any questions if there are any now. And if not, I know that the slides and the recording of this webinar will be available later, and we're providing our email addresses and are more than happy to answer questions or talk with you if you'd like to follow up later.
Well, thanks, Carrie and Florence. For the audience, if you do have a question, please feel free to type your question or comment right into the chat, and Carrie and Florence can try to respond to it and provide an answer. While we're waiting for that, I wonder if you might tell us a little bit more about the changes that enabled telehealth to be used during the COVID crisis. That was something that was new for me.
Carrie, do you want to answer, or would you like me to do it?
Sure, I can say a little bit about it, and then feel free to chime in, Florence. So in general, there have been several very recent changes since COVID that expand the availability of telehealth and make it easier for providers to be reimbursed for telehealth when they used to need to be in-person visits to be reimbursed. The definitions around site of care have been expanded to, which creates new flexibility. One caveat around all of this is that good telehealth relies on good access to either telephone connectivity, cellular connectivity, or in many cases broadband access. And so it's not a panacea. It may still be leaving some people out, but it's certainly an important next step to try and expand access during this current crisis, but hopefully beyond too.
Thank you.
Yeah, and if I may add, this is also one of the things that there's probably a lot of variations too based on healthcare providers and whether they currently have the infrastructure or not. But I would say that I was talking to the director of the telehealth services here. So my research institute is part of the rural healthcare system. And he was talking about how those changes are really making a big difference, that overall they have gotten very good feedback from patients who've been able to continue to obtain care during these times of social isolation. And there is a lot of conversations about how do we keep those changes moving forward, because the understanding is there has long been, there's been a call for a long time for more telehealth, in particular for mental health, in particular because of the issues connected to the stigmas and people not wanting to go, see to a mental health care provider, not wanting to be seen, and telehealth provide an opportunity to do it in a place that perhaps is more private.
Thank you. I see you have a couple of questions from Tanya and Scott.
Yeah, I can address Tanya's question briefly. For the environmental scan, we were looking at the availability of programs. We were not looking at the effectiveness of programs. But we know from other research that information that's delivered in a very one-way, passive format, such as tip sheets, how to deal with your stress, how to cope, those only go so far. They have limited effectiveness. They're important and necessary to get the word out, but they are not enough to solve mental health concerns and serious mental health problems.
And I think, if I may add, this is an area where we haven't seen a lot of looking at the literature, right, looking at the scientific literature, or even program evaluations, we haven't seen much in terms of evaluation, the extent to which these programs are working or not. But I would say, having gone to some of those webinars, they usually do include some questions about, was this information helpful to you? Do you plan on using it later on?
Yeah. In terms of Scott's question, this was probably one that requires a much longer answer and much more detailed discussion, but Scott is wondering how much we can truly trust agencies of agriculture and land-grant universities to be credible partners in this work if they are also actively promoting policies that underlie farm losses. I'm going to give an unsatisfactory answer to this, but it's that I don't think we can do this work without engaging them in some way. And full disclosure, I'm employed at a land-grant university, and so that's where I work. But I think they're such big, important players in both the agricultural space and the research space here that they are necessary pieces of the puzzle. Florence, I don't know if you have a more thoughtful response to Scott's question. It's certainly a valid concern, and it's something that I think any research partners, anyone we engage, you need to think thoughtfully about what everyone is bringing to the table, good and bad.
And I think, Scott, it is an excellent question, and we do know in terms of farmers accessing extension services, we do know that there are subsections of farm populations who do not engage with extension for various reasons. We know, farm women, sometimes it is the case that historically they felt that their needs haven't been served. Minority populations as well have felt that their needs haven't been served. And even we know from the farm crisis of the 80s that there were farmers specifically who felt that, extension got them kind of in this pinch in terms of the kind of business recommendations that were made and in terms of practices that were promoted. So I think that is an excellent point. And I don't know how extension is grappling with with their legacy in some ways.
And then it looks like we have one final question here from Megan, who's wondering if we looked at the secondary stress of children of farmers. Megan, we didn't focus specifically on children of farmers, but we did in both our environmental scan and our interviews with key informants talk about farm families broadly. Often when farm families came up, they came up in the context of couples, and so what was happening within a marital unit or any other couple. But certainly children are an integral part of that. It wasn't a key focus of what we did, but it would be disingenuous to do this work without thinking about children and without thinking of the well-being of families in general. There are other people who are focusing more directly on the well-being of children, and I think it's an area where we would benefit from more information and more research about how to best serve them.
Okay, it looks like we have maybe one more question coming in from Carrie. We'll wait for that. And
I see that there. It looks like Carrie has more of a comment than a question by talking about adult children in terms of legacy farms. And for that, that's absolutely something we heard a lot about. It came up quite a bit in the key informant interviews as, in many cases, a source of stress for adult children who were trying to carry on the legacy of their parents' or grandparents' farm and felt in some way like they weren't living up to their expectations on them because it simply wasn't possible in the current context. So we heard quite a bit about that, and it's a really important point.
Yeah, and we know that has an impact too on whether even younger children, you brought up the question of younger children, right? Children who are seeing their parents struggle, to what extent are they going to want to take over the farm? And we also know that in many cases, there are farm parents who are saying, I don't want you to take over the farm because it's too hard. And so there's definitely a lot of connections around the life course and even things that are happening now, how they're going to pan out in 15, 20 years when it's time to transfer over to the next generation. and whether people want to and can.
Carrie and Florence, thanks so much for presenting your work and doing the important work of collecting this information and sharing it. And we really appreciate all of what you have done and wish you well and all the additional work that you'll be doing out of it. Thanks everyone for joining in, and please take care and stay healthy, and we'll see you again soon. Florence and Carrie, thanks so much for